it was unclear, and it became so clear that the immune system was so important, was associated with the progression of cancer, with the life or death of people.
And I consider development of cancer immunotherapy, as we currently know it, really a victory of fundamental science.
Skepticism is what best described the viewpoint of the scientific community even only a few years ago, when researchers associated immunology with oncology. Nowadays, these two scientific and medical disciplines have become inseparable. When he started in research 20 years ago, Ton Schumacher, a Dutch biologist based in Amsterdam, never imagined that he would be one of the curious and tenacious scientists who would break down this barrier and prove that our immune system can recognise the presence of a tumour at a very early stage, just as it does with a virus.
Our body has millions and millions of immune cells called T cells, which scan the body for cells that are not normal, where there's something wrong. And we certainly understand how those T cells could recognize cells that were infected with a virus, but we didn't quite know how those cells could recognize cancer cells, distinguish them from healthy body cells. And what we've done in our research is show that the DNA damage that's characteristic of cancer cells actually leads to the formation of new structures on those cancer cells that can be seen by the immune system. And in a way, that's also I think, conceptually appealing thought, because it indicates that the DNA damage that on the one hand is responsible for cancer outgrowth is on the other hand also a means for the immune system to see those cells as aberrant and see those cells as cells that need to be destroyed.
The discovery that T cells can kill tumour cells by recognising these neoantigens underscores the importance of immunotherapy in the treatment of certain cancers. These treatments combat cancer cells using checkpoint inhibitors, which prevent the tumour from hiding from the immune system. By highlighting these neoantigens, Ton Schumacher enables these treatments to be better targeted, a finding he was able to make here at the Netherlands Cancer Institute in collaboration with John Hannan, a medical doctor working in this institution, which is both a hospital and a research centre.
The whole idea about the tumor mutational burden, the generation of neoantigens, was something that he already early on saw as a major possibility to work on. And we were one of the first, and maybe the first, to show that at least for a patient treated with immune checkpoint blockade, neoantigen-specific T cells were important.
What we think we can add with our understanding that the immune system is directed against these consequences of DNA damage is to also make that immune cell activation more specific and not activate the immune system across the board, but really steer the immune system towards those characteristics that distinguish the tumor cells from healthy body cells. So we hope to utilize this knowledge to create more active immunotherapies.
It's bringing the lab and the clinic very close together. And this is something of the last 5 years where all of a sudden, there's areas where the researchers are sitting across the table from the clinicians and saying, this is where the problem is, this is what we want to do, so it's very much closed the gap too. It makes it very exciting.
This close contact between fundamental research and clinical applications stimulates the development of novel cancer treatments. It's also thanks to his technical approach that Ton Schumacher has made his discoveries and sees his future research.
One thing that has been a common thread in my career is that we've developed technology to measure what immune cells recognize. If I look at the future, many years from now, what I hope to do is develop approaches that allow us to predict what an immune cell can recognize.
Predict and anticipate the development of a cancer and evaluate our body's capacity to fight it. For many years, Jérôme Galon has focused his research on the abilities of our organism to respond. Here at the INSERM Paris, this French biologist is studying the nature and intensity of our organism's immune response when faced with cancer. Analysing the tumour environment has enabled him to conceive a diagnostic tool.
In a given tumour, there is always a tumour microenvironment. So it's a very complex system, but ultimately, all these parameters will end up into a generation of a strong adaptive immune response or not. And so what we found was that the presence of these T cells were associated with the presence or absence of tumor progression, were associated with the invasion of cancer. So in fact, all the key parameters of tumor evolution and of cancer evolution are dependent upon our immunity, our adaptive immune cells.
In order to measure our body's capacity to mount an effective immune response, Jérôme Galon's teams carry out a detailed analysis of tumour tissue. They focus on the T-cell lymphocytes, which are present in the tumour environment. Using an innovative calculation methodology, they are able to predict the risk of relapse of the patient, his immunoscore.
So this is what we are measuring here, and we can see this very nice brown staining of T cells and cytotoxic T cells on this patient. This particular patient is a very high immunoscore because of these very dense areas within the center of the tumor and within the invasive margin of the tumor. When a patient was coming at the hospital, the clinician didn't know whether the patient had a good immunity, a bad immunity, an immune response to his cancer or not. So immunoscore is the first test that is telling something about the patient, about the immunity of the patient and its capacity to fight against its cancer or not. So it allows to classify the patients into high-risk, low-risk patients based on their immunity. Second, it also predicts the likelihood of response to treatment.
Today, the immunoscore improves the diagnosis, treatment and follow-up of certain cancers, a calculation method offering not only real perspectives for cancer treatments, but also a better understanding of tumour development.
So by looking only on this readout, on this test, it is the inclusion and the incorporation of several years of work that is coming from the basic research. And that's a very good success of the idea that research and to improve also treatment is coming first by better understanding the basis of how the disease develop and what are the mechanism of development of the disease.
The immune response and the immunoscore are now recommended by the WHO and by the European and Asian Clinical Practice Guidelines for the classification of certain cancers. It is a method that Jérôme Galon has pushed through with determination and tenacity. He was also able to develop the tool through his association with specialists in biotechnologies, a prerequisite nowadays for making progress in research and translational medicine.
At some points, we cannot do any more in academia, and we need a different environment, different types of capitals and funds to be able to move to the next steps.
Jérôme Galon, pour moi, c'est l'exemple que je prends souvent vis-à-vis des jeunes chercheurs pour montrer qu'on est capable de faire, qu'on ne peut pas opposer science et transfert de technologie d'un côté, qu'on peut faire les deux en même temps et que justement l'un va alimenter l'autre.
Academic institutes have become more interested in the further development of the knowledge that they create. And the other way around, I think also biotech organizations have become increasingly interested in early discovery.
There is a bridge that is really needed to really push and to really make discoveries something useful.